Okay, now we're working on sinus pressure relief. So we're going to focus on the foramina in the face. So we have supraorbital, infraorbital, and our mental foramen. So that's what we're going to be pushing away from, okay? So usually when someone comes in, they're going to feel all this pressure right here in their face, okay, right in the sinus cavities. So we're going to try to push all of that pressure away from the face and then down towards the neck lymph nodes and the armpit lymph nodes, okay? So I'll start up here in the face, and I'm just going to do little pressure that follow the eyebrows, okay? So this is going to be right over the supraorbital foramina, and then I'm slowly going to go more and more. So let's say I divide them into thirds. So I'll go 1/3 here, and then I'll go 2/3, and then I'm going to go all the way here. And then you're going to feel this little divot on the side of your head here. That's going to be where the ethmoid and the sphenoid bones come out. And that's actually the top bones of where the sinus pressure can be. So if you put pressure on there, you're going to push down towards the bottom of the table, meaning posteriorly for them, and deep, and then that's going to actually kind of help open up some of that cavity and provide some relief as well. So starting in thirds, eyebrow 1/3 here, then 2/3, then go to the full, and then we're going to put pressure there, and then we'll do it on this side. So 1/3, then we'll go 2/3, and then full, and then you can kind of do that symmetrically, and then just hold that pressure. Now as you apply, it's not a ton of pressure, but you're just going down posteriorly and deep. Excuse me.
That's good.
Okay. Good. And then we're going to work on the frontalis muscles. So all we're doing is just an upward pressure. You can imagine you're just coloring in their forehead, if you will. Okay, so whenever you see redness, that means you're increasing circulation in the area. And then now we're just going to start to push that slowly out this way, towards the side. So after a few passes that way, then we're going to go into the masseters. Working on the masseters, keep in mind that they work in conjunction with the temporalis muscles. So whenever we're working on the temporalis, we can go here, and we're just going to do, deep friction and petrissage. How's the pressure there?
Right.
Okay. So you just kind of work your way down, and then you're going to get to the zygomatic arch, and you're going to go just underneath that. Now the temporalis muscle actually goes all the way into underneath there, and for you to get that, you just ask your client to slightly open their mouth, and then you can grab onto that temporalis right there, and then relax. So then you can still kind of do that, and as they open it, they're kind of stretching that muscle for you, and you can still work on that inferior portion of the temporalis, and then now you're already ready to start working on the masseters here. So we're still doing circular friction. Now, I like to warm up the area on the masseters. And then I'll actually have them kind of clench their jaw. So what that does is it shortens the muscle as I'm stretching that whole thing out. Okay, so what I'll do is I'll have them gently bite their teeth together and relax. And as they relax, then I'm just going to kind of go straight down with the fibers of the muscles. How's the pressure there? Okay, go ahead and bite down again and relax. So I have them relax as I'm going down, so it's like you shorten the muscle and then we're going to stretch that out together. Okay, and bite down and relax. Good. Doing okay there?
Mm-hmm.
All right. So then now we're going to get into the Orbicularis oris muscles and oculi muscles. So we're going to be getting all of right here underneath the cheeks. And this is going to be where the infraorbital foramina are. So all I'm going to do is just follow the zygomatic arch all the way down close to the ears. So just going all the way down right here. And that's going to be where people who are having a lot of pressure are going to feel very, very tender. So how's the pressure right there?
Right.
So all I'm doing is kind of hooking under that bone and just getting a little bit of separation from those muscles. I'm going to work my way all the way down to the ears. And these spots right here, right at the very tip of the zygomatic bone, you can just kind of hold those spots, and that'll help with that sinus pressure also. Now, we're still working on that sinus pressure release, but now that we've got all the fluid and everything kind of moving down this way, we're going to complete with kind of getting underneath the chin, and we're working on now the mental foramina. So how are we doing right there?
Good.
All right. So all I'm doing is going to pull away from those 2 points. I'm going to kind of just run the length of her jaw. How's the pressure? And then now, just to put it all together, I'm just going to kind of get one, try to be as smooth as possible, and move down. And then I'm just going to go down the neck and then out towards the armpits here. And I'm going to do that a couple times. And I mean, you can do it from here, and it's very, very soft pressure. All we're doing is just trying to facilitate the lymphatic system and just get that flowing. So now that we've done that, now we can go to the occipitalis muscles. So what I generally do, I'll tilt it this way so you all can see. Occipitalis muscle is going to be from the occipital ridge all the way to about right here. So remember that when people are having vision issues or tension headaches, it can be caused from all this neck here, and then these pull tighter, then this pulls tighter, and then you start getting headaches in the front of your head, side of your head, and those kinds of things. So everything's connected. But what I want to do is just deep circular friction. How's the pressure there? Okay. All over the occipitalis muscles. So I'm going to kind of do like the whole head. I'm going to get temporalis and the parietal areas as well. So notice what I'm trying to do is I'm trying to lock my fingers into a spot and then just kind of move those spots. That way it's deep friction. Otherwise, if you're doing superficial friction, then you can start to like pull hair, which it'll feel good if you're doing it lightly, but if you're trying to do deeper pressure, then you can start to pull. Okay, so how does that feel there? All right, so just relocate your hands, and I usually do 1/2 of the head this way, and then I'm going to tilt her the opposite way, and then complete the rest of the head that way. Okay. Now after I do that on both sides, then we're going to address the erector pili muscles. So what ends up happening is people who tie their hair back, or women or men with long hair, they might have their hair just pinned up in one spot all day long, which can add to headaches as well. So what I'm going to do is I'm just going to grab a little bit of hair, and I'm just going to go in like kind of a circular motion. How's the pressure there? So very lightly, you don't want to just rip their hair out. But this is where that saying comes from, where you have that feeling you want to just pull your hair out. It's actually a stress reliever because you're addressing those muscles.